One of the things that we do that's unique at Leavitt Partners is we bring together multi-sector stakeholders to try to solve really difficult issues in healthcare. This is a really difficult issue in healthcare, right? So this certainly we gravitated toward this. And just as a little bit of background, one of the things that we've done over the last 7 years is we've worked with both Democrats and Republicans and the industry to figure out a way where individual consumers can get more digital access to their healthcare data. So as Chris mentioned, the average human doesn't want to download terabytes worth of files. They need some kind of technical mechanism to make good on all the great things that Kerry and his team are publishing. So there needs to be some kind of a technical mechanism that says, how do I make sense of all of this stuff? Well, as we've been working again with both administrations, we've been able to say, hey, look, actually, there's a way to do that now using modern internet technologies, as well as a whole host of thousands of other well-intentioned folks that have said, we can actually do that. We can use modern internet technologies called application programming interfaces, or APIs, which is the same way that data gets exchanged today in your consumer world, that you can now access all of your healthcare information on an app of your choice. We've never had that ability before. And really, as of last year, both health plans and providers now have to make available these APIs so you can download both your administrative claims information, financial information, as well as your clinical data on an app of your choice from any payer or provider in the country. It's under the guise of CMS, but essentially it's nearly everyone. Commercial side, we don't have yet because of regulatory authorities, but we're getting there. I guess the idea here is, how do you figure out a way to now make sense of this? This becomes revolutionary. You as a consumer can use an app of your choice. There's a bunch of them listed on a website that we help lead called myhealthapplication.com. There's about 25 of them out there now. And there's going to be, I'm sure, dozens and dozens, if not hundreds of more apps that make available. Apple Health, as well as Google, through their partner called Common Health, has actually made this available directly in their operating system. You can actually literally download all of your information from any of these payers or providers in the country. This is truly revolutionary. Now, if you couple that with the data that you're going to get in terms of pricing data for out-of-pocket costs for any of the hospitals in the Utah region or the Intermountain region, or any of the the payers that you may be going to, all of these things start to come together in a coherent whole. We've got great vendors out there like Chris who are trying to make sense of all of this stuff. Kerry and his team and other health systems are publishing this data. Now we need to take all of that, along with my own personal clinical data and my financial explanation of benefits and my out-of-pocket costs and all the things that I have related to my coverage type, and put all that stuff together. Now it start getting really fun. Now it's like, okay, now I can start to think about this stuff in a real meaningful way. Jen, I'll just give you one example that some may not be aware of, but there's an API that's now been available called Real-Time Pharmacy Benefit Check, where you can actually say, hey, I've been diagnosed this specific drug. As a result of being diagnosed this drug, I can look at in real time, how it affects my formulary and benefits, my out-of-pocket costs, my therapeutic alternatives, and whether I should pay cash or use my benefits to do this. And there is a wild swing of 50 to 75% on average of costs associated with that out-of-pocket. Now, if you go to any Democrat or Republican, they'll tell you the same thing, that pharmacy costs are too high. But as a result of this actually becomes a really interesting way in which consumers can now be empowered there's differences in price of whether you go to Walgreens or Walmart, for example, to fill your script. And so now it starts to become really real for the individual consumer, not only aggregating their own data, especially if they have a chronic condition, but then being able to see how their out-of-pocket costs are going to be affected. And as Chris and his team start to make sense of all this data that's coming out, then consumers can say, what does this actually start to look like across health systems? I need to get an X-ray. The quality measures on an X-ray is pretty much the same, but how can I figure out where do I need to do that the best way? Kerry may say, look, let's go to my outpatient facility rather than my inpatient facility. Let's figure out a way to make this happen so we can provide it at the most effective, use and place of service possible to make this happen. This starts to get really interesting, Jen, and all the money we've spent to try to get to this point over the course of the last 15 years starts to really come forward in a meaningful way where we can start to become transparent. So it becomes a matter of, hey, I have a specific need. My need is related to, like you said, either chronic condition or out-of-pocket costs, or I need, like you said, I need to go figure out an MRI. It's going to take some time. Chris's team is working really hard on this stuff. It's going to take some time to figure out, make sense of all the data, normalize the data. I won't get all the technical stuff, but this is going to take a little bit of time to try to figure this out. I will tell you, Jen, before I answer your question, the biggest impact, and I'm interested to hear Carrie's thoughts about this, is actually happening in the healthcare industry right now. The industry impact is huge because right now you have the situation where payers are now downloading all of the negotiated rates from every health system in the country. And that has caused some tension, and Carrie's going to comment on this. That's caused some tension in terms of, wait a minute, you told us one thing and now this is something different. And what does this start to mean? And does that mean you need to get to the lowest negotiated rate in your specific region of the country? That becomes really interesting. Let me answer the consumer question. I called Carrie out, so I'm going to have him answer. The consumer question is really simple, which is, look, I have a procedure and that I need to go through. My doctor, for example, has diagnosed me with this, or I need to go, like you said, go get an MRI. I need to figure out if that, which of the health systems are in my network, which of the ones that can provide that MRI, and then which of the ones that are potentially the lowest cost and the highest quality. I need to answer that those series of questions, and based on providers whom I trust. And the goal here is to bring that into an application, have it be health system and really payer agnostic, and so that individual consumer can then kind of start to be empowered with that information. As Chris mentioned, his team is accessing all this data from all these different health systems, but the challenge has been that they publish the data in just a little bit different ways. And part of the reason for that is because we actually deliver care just in a little bit different ways. But surprisingly, we actually deliver care pretty synonymously, pretty much the same, depending on the situation, and about 80% of the time. And so we have to say to ourselves, well, if I'm a consumer and I am looking at a bundled set of services. So for example, if I'm going to get a knee replacement, there isn't one code for a knee replacement. It actually makes up a series of codes related to a knee replacement. And those series of codes make up what's called bundled services. And those bundled services is a package of services that make up a procedure. Well, if I'm going to go and kind of shop around, for example, to find the highest quality, potentially most reasonable costs at the most trusted health system I want to be able to figure out a way to do that so that I can standardize the information in that package of services. Right now, there's a bunch of proprietary solutions out there that actually create these package of services. We've worked with Chris and his team at Turquoise. We've also worked with what's called the Healthcare Cost Institute that actually does a lot of work on the payer side related to Medicare, as well as PACES, that was a not-for-profit that's been funded under Johns Hopkins, where we said, hey, how could we actually put all of those folks in a room and then actually start to define these bundled services in a way that's consistent across different health systems. So when the health system actually publishes these rates and they relate to bundled service packages, that these bundled service packages could be defined in a similar way. Because they're already doing it anyway, we might as well make it more usable for the consumer. So as of today, world exclusive, Sean, this will be great, is that we are launching what's called projectclarity.health. You can look it up online now. The website's live, called projectclarity.health. And what Project Clarity is doing is trying to say, hey, if we could be able to use the information that's already out there in terms of billing practices and claims information, others across literally millions of doctors all around the country, and we can look at those claims patterns, put a clinical lens on it as well, and say, here's how we would define those individual packages. We can really voluntarily standardize the packages across different entities. So when they publish that information, they're publishing it in a common way so that I, as a consumer, can really look at apples to apples when I go out and try to find this information myself. Now, over time, we're going to add to that. And the goal is to add, for example, quality measures on top of it. Because, everybody who does, for example, knee replacement doesn't get the same outcomes. There are some higher quality institutions like Intermountain and others that provide way better outcomes than potentially if you were to just go to your local rural hospital. So we have to figure out a way to say, we've got to add quality components onto this as well, because people need a full spectrum of what is required for them when they actually go out and look for and shop for, I should say, these specific services in the future. So it's going to take months, maybe even years to actually get to that endpoint. I guess the goal here is that we now have a group of really interested individuals that want to be able to put this together in a more humanly digestible and standardized way across the different health systems based on the data that we're seeing in terms of billing patterns. Years ago, I didn't know I needed one of these things that, if you can see it, the phone, right? Like now everyone has it as literally an extension of their hand. So then you say, well, what empowerment has that enabled them to do? Well, literally, industry and companies have been created, literally billion-dollar companies, as a result of freeing the data, empowering consumers, allowing for shoppability, making things transparent. I think what I would say, Sean, at a global level is we tend to think about healthcare in the current boxes that we operate in. What this is going to do is literally just tear down the boxes completely. I mean, we're going to have a situation where companies that we couldn't even imagine now, today, are going to sprout up as a result of this type of innovation, because that's what's happened in the internet world, right? You've got Uber and Lyft and Airbnb and all these companies that have never been in the transportation business or the hoteling business have now actually sprouted up because of the ability to empower individuals with access to their data. We anticipate that the same thing, Sean's going to happen here. When this frees up, you're going to see all kinds of decentralized and very specialized business models that are going to go after unique situations. We're already seeing it on our side, Sean, with the work we do in the Caring Alliance, which is about, like, we have apps that are just focused on getting people into cancer clinical trials to save their life. And all that's their only focus, right? Now, Jennifer mentioned the privacy component. For somebody who has stage 4 colorectal cancer, they're not as concerned, at least the patient advocates have told us, about where their data is being shared. They're concerned about saving their life. So they're going to figure out every way that they can to get into the clinical trial that'll save their life. We now have services that will actually make that happen by aggregating all their data into one place and then getting them into the right trial to make that happen. I think you're going to see that more and more. You're going to see solutions, and you're seeing that in the digital health space, that are going to happen across the board.